All right, today we're talking about the biggest scam that I can think of. You know what time it is. It's the end of the year. That means you got to go onto healthcare.gov and you got to sign up for health insurance. Health insurance, great. It's going to cover everything. Nope. Today we're going to be talking about healthcare in the United States. We're going to talk about why it's so awful and some of the things that really piss me off as a young person who is feeling like they're gambling with their health. So first off, let's talk about my situation. My name's Andy. I make around $45,000 a year, and the healthcare plan I just selected is with Kaiser, who I will talk about later because I hate them with every bone in my body. But my premium for the next year is going to be just shy of $400. And when you take that into account, pre-tax for my income, that's more than 10% of my income going towards health insurance, which is great. You know, you got to have health insurance. What if something awful happens to you? Well, it's not going to cover it. The plan I signed up for is a gold plan. And gold, gold is shiny, gold is first place. You think that that'd be pretty good, right? Let's go on to the healthcare plan that I have and show some of the 3 example situations that could happen and the costs that would be associated with them. So the first one, having a baby, $2,860. Next would be someone with type 2 diabetes, something that they did not decide to have, $1,120. And then finally, a simple fracture, $1,200. So I'm paying 10% of my income pre-tax for something that's going to cost me an additional between $1,000 and $3,000 based off of what's happening. That's unacceptable. Let's talk about healthcare in the United States. In 2020, the average national cost for healthcare was $456, which is actually less than what I'm paying. So maybe I found a good deal? Probably not. Even with that high premium cost, the out-of-pocket max under the Affordable Care Act is $8,150. This means that this is the max amount that you'll pay underneath these plans before the healthcare provider pays the remaining of it. So $8,000, sure, for a situation where, maybe you have open heart surgery, maybe you have a cancer diagnosis. That's going to take up a bunch of the cost. That's $8,000 for a country that is pretty bad at having savings to be able to pay for this stuff. When you look at the stats when it comes to money, 63% of Americans are living paycheck to paycheck, which is the idea that people are making money and it's just going right out the door. So for a situation like this, yes, you're paying healthcare costs, you feel like you're covered, but then if you have this situation pop up where maybe you actually need to use the healthcare that you're paying for, people are not going to be able to pay it. Then you look at 44% of US adults are able to pay a surprise expense of $1,000, and you get to a point where you are coming up with huge medical debt for people in the United States. This graph on the screen right now shows medical debt by percentages based off of brackets of $200 to $500 all the way up to more than $10,000. And 13% of people that have medical debt, it's more than $10,000. I feel like this would be less upsetting if the United States was good at healthcare. If you're paying for something that's more expensive than everywhere else in the world, you would expect it to be higher quality. Obviously, we know that's not the case. You look pretty much anywhere, any statistic when it comes to healthcare, we are near the bottom when it comes to highly developed countries that have high standards of living. And that's not okay. When you look at this graph right here, it shows GDP per capita on the x-axis, and on the y-axis is healthcare spending per capita. You see a very nice trend line with a lot of countries falling pretty close to it. And then that green dot is the United States, which is way off the line, meaning that people are making more than most of the countries on average when it comes to GDP, but they're paying significantly more for their healthcare, and that is not okay. My main problem with for-profit healthcare is that you don't choose to have health problems. When it comes to car insurance, you have a varying degree of how much you pay based off of varying factors, how old you are, your driving record, and especially what type of car you drive. You can pick what type of car you drive. If you can afford a very nice car, you're going to pay more in insurance because it's going to cost more to insure it. And it's required to have health insurance to drive a car. You can get away with not having a car. Health insurance, if you don't have health insurance and you have a health problem that pops up, you're going to be in crippling medical debt, and it's going to make it more difficult to get affordable coverage in the future because of those pre-existing conditions. These high costs lead to people avoiding medical care at all costs. You see all these things about people not taking ambulances to the hospital when they're in serious need of medical attention because of the huge prices that are going to be associated with that. You have people not going in for their preventative care, which is going to allow people to catch cancer diagnoses much earlier, stuff that is going to be very beneficial for them in the long term, but it might have huge costs if they either find something, and even if they don't, those costs associated with seeing a healthcare provider can be more than people can afford at this point. We already talked about how many people are able to pay for a $1,000 expense. Healthcare is not cheap, even if you have health insurance. My situation right now is my girlfriend is desperately trying to get me to go to the doctor to get, just an annual checkup. I keep joking that, they haven't checked me out, so maybe I'm just the healthiest person that they've ever seen. In reality, my worry is that they're going to find something and it's going to destroy me financially. I have health insurance, but I have a lower cost health insurance for this year, meaning that if I have to go in and see a doctor, it's going to be very high out-of-pocket costs because these health insurance isn't going to cover much. Yes, I have the max $8,000 out of pocket that we mentioned from the Affordable Care Act. I don't want to spend $8,000 if they find something. That is money that could be going pretty much anywhere else. I'm trying to save up to buy a house, and if I have some awful diagnosis, that's where all that money is going to go, and I'm not even going to be able to afford all of that. Getting healthcare isn't something that you should be convinced to do. You shouldn't need someone that cares about you to urge you to go get healthcare. That is not how we're supposed to be going about things. We want to be healthy people and we want to make the right decision, but you have to weigh the financial decisions with it along with, just being healthy. Picking healthcare at the end of the year feels like I'm gambling with my health. My decision last year was to pick the cheapest healthcare out there and just pray that I didn't get sick or hurt and need healthcare. It ended up working out, and as a result, I saved, last year I was spending less than $200. Now it's going up to $400, so I saved, $2,400 by having bottom tier health insurance. That's not something that I think is acceptable. Gambling with your health is not a sustainable way to increase the quality of life of people in this country. And that really does not sit right with me, especially when these healthcare companies are making billions and billions of dollars off of this overpriced insurance. Kaiser Permanente, which is one of my least favorite organizations in the world, reported a net profit of $8.1 billion in 2021, despite shrinking operating income. Oh no, they're making less money. $8.1 billion of net profit off of healthcare, which in my opinion should not be for profit at all. If you want to really get upset, watch this video that I'll have linked below and I have up on the screen right now from Vox called "Giving Birth Costs a Lot, Hospitals Won't Tell You How Much." Price gouging is a huge thing, and as a result, they don't want you to see how much you're spending on each thing, and it's very difficult to get an estimate on how much things cost, and to get an itemized receipt, you have to jump through a lot of hoops, and I don't think that's right. We should make this as accessible as possible. We should have some ways of paying for it, because the second you talk about, taxpayers paying for health insurance, people get all up in arms. But when you look at it, the way the healthcare is set up in the United States is not set up for long-term success. You have people in crippling medical debt, people paying for huge premiums, and you're paying more with these premiums than other countries that are paying for it with socialized medicine, and you're getting significantly worse care. And I think we really need to do something about it. And every year I have to sign up for healthcare, I get this overwhelming feeling of dread, like I'm being, underinsured, I'm getting overcharged, and I hope I just don't have to use it. And I feel like I'm gambling with my health, and that is not okay in my opinion. We need to do something about healthcare. Let me know your suggestions on how we can fix this in the comments down below. If you're signing up for health insurance, good luck. I hope that you pick something that you never have to use, but it's tough out there. So this is the first video on this channel. If you like this video, be sure to hit that like and subscribe button. I'll see you in the next video.